Hi, everybody. Welcome back. Terry Kuti with Deep Sea Foundation. You can find us over on the Deep Sea Foundation YouTube channel and also listen over at the Deep Sea Journey podcast. I would like to introduce my guest this morning because she is a returning guest, and her name is Dr. Silvia Kurtovic. She's part of a team of surgeons at Tucson Plastic Surgery, and she works with Dr. Raman Mahabir performing a number of reconstructive procedures in Arizona. Dr. Kurtovic is a board-certified plastic surgeon and one of the few female surgeons in Arizona who is both a diplomat of the American Board of Plastic Surgery and a fellow of the American College of Surgeons. Dr. Kurtovic did her plastic and reconstructive surgery residence training at Duke University Medical Center, and she received her fellowship training in aesthetic and microsurgery, specializing in deep flap surgery in Canada. I always think that's such a powerful combination of aesthetic and microsurgery specialization. I'm really glad to have you back, Dr. Kurtovic. Welcome back.
Thank you so much, Terry. It's so nice to be here again.
Yeah, I'm excited about this podcast and YouTube interview that we're doing. It's a special topic, I think, to both of us in many ways. So I'd like for you to start out, if you don't mind. You have personal experience with breast cancer and being a caregiver at a very young age. Can you share that story with us about your mom, Dr. Kurtovic?
Sure. Yeah, all of that, my first exposure to breast cancer was before I was in medical school. I was in my early 20s. And my mom sadly got diagnosed with a pretty aggressive subtype of breast cancer. So she was really dealing with it for about 2 years and passed. I will say, you know, when that sort of showed up for me, it was at a really pivotal time in my life because it really was something that I took with me as I went through medical school, through all of my residency training and fellowships and all of that, because I really sort of had this deep passion and perspective to really pay attention to some of the needs of patients like that. Having been first a caregiver to a woman going through breast cancer, and then being in training and then learning how to do all the surgery and kind of coming up with my own style and practice even of how I want to deliver care and really how I want to show up for patients in a way that I felt like for myself and my family when my mom was going through it, a little bit of that, was lacking. We didn't really get always the best information. It didn't feel like that experience was a little negative for me when I, kind of went through that. So that was something that always motivated me to make sure that, I paid attention to patients' needs, to their families' needs, because it's very unique.
Mhm.
It's not just, we're not just bodies with an area of disease that needs to be addressed. We're a whole being, and that whole being needs to be addressed. So those are things that are important to me in my practice.
Well, I like it that you take this holistic approach, and I can really imagine how much, the passing of your mother from breast cancer and going through medical school had such a huge impact. So I do hope that any residents or fellows listening to this today can hear your voice and the importance of this holistic approach. Um, I I want to talk to you. So, looking at your social media accounts and your website, which all are full of great, valuable information, I want to talk to you about a retreat that you had in Tucson. And when I looked at the photos, when I looked at the videos of that, it seems so transformative in so many ways. Tell us more about that and just not only what you got out of it, Dr. Kurtovic, but also give us a little peek into what you saw in the patients and what they got out of it as well. Tell us
Sure.
about it. Tell us about it from start to finish and how it all became.
Right. So the retreats we have over the last couple of years, we've been able to host a yearly weekend retreat for our patients who've undergone breast reconstruction and are kind of at the end of that surgical journey. That's kind of the idea, is to get, a unique group of women who have shared experiences, who have essentially finished all their treatments, all their reconstructions. Sometimes they get revisions, things like that, so that we can begin exploring what happens after. I had a patient once, after we had done her deep flap and her revision, and she said, okay, now we've done all these things. I had been taking care of her for about a year. And she says, okay, Dr. Kurtovic, what's next? And I said, well, what's next? I mean, that kind of opened the perfect segue when I thought she'd be a great participant. She'd be great to include for this. So, what we really do is we create this weekend of time where our patients, they can get away from their day-to-day life, their families, their obligations, all the things, so that they can meet other women who've had their shared unique experiences of having either, gene positivity or breast cancer, and who've had all those treatments. And really, when you go through that, no matter what, even with all your family support, uh, I think every woman really feels alone. That's a common thing that I've heard over and over again. When you're a patient, your world just shifts, and all of a sudden you're in this world with yourself, right? And kind of, what about that relationship of that woman who's going through all these experiences and surgery and removing a part of her, either part of your breast, whole breast. I mean, I think a lot of times that takes away part of a woman's um, femininity and sense of identity and sense of, belonging, and who is she now, now that she's gone through that. She's going to feel different, scar tissue, side effects from chemo, this and that. So how do we help bring people into a unique setting where we can offer them um, basically an opportunity to form connections, form relationships, friendships, bonding, support in their community, to realize, hey, I'm not alone. It's okay. Or, what I see in these weekend retreats is they start to share their stories, and they really start to break down the barriers of, they go back to their life after all these, after having had this tremendous experience. But when they get together in this intimate way, which is safe, we're in an Airbnb house for a couple of nights, away from everything, and really being able to focus and nurture their being present with being able to look back and share their stories, right? Because I think this is so therapeutic. And just having that collective space that feels safe and supported for them to start to share that and to let go of some of those things, and then undergo some new experiences. And so what we do is, at the start of it, we really do things to help them get into their body. That first day, they get a facial from one of our estheticians, and then they get some body work, a massage. So we allow them to have these experiences to first kind of just like, okay, leave your life at the door and be open to something totally new and healing, which really happens on its own. It's not even something that I am doing or the people that we have there that are really doing. It's sort of this healing has a life of its own and a personality of its own based on the group of women that show up, right? They all kind of show up. They're not really sure what it's going to be. And over those few days, things evolve. And what we really do to help that is we incorporate healing through photography. So by having really the right people there to help guide that, really magic can happen. So we've worked with Caroline King, who's an incredible photographer who was out in Tucson for some of her graduate training, but she lives in Brooklyn, New York. Talented photographer who we bring out, and she does these beautiful intimate portraiture, kind of like boudoir, but we took it out of that sort of the boudoir setting, and we did it in a studio kind of backdrop where we can really focus on their bodies so that they can start to have new experiences and start to see themselves differently. And they're not just there by themselves, they're there with their new friends who are also going through this experience. And it's incredible. I mean, you'd see, women who you'd never think would ever agree to sign up for something like this. And then they trust you, and then they show up. And then by the next day, they're completely, walking around in their underwear, not worried. Like, just enjoying it. And it's just incredible and liberating. And so this is something where just kind of watching that unfold on its own has really um, been beautiful to witness. I had this idea of, what if you put these sort of ingredients together, what is going to happen? And literally, it's magic and it's healing. And I'm always blown away every year. Um, I get these profound stories where they say, this changed my life. My life is different. I'm not the same person. It's like to me, I kind of look at it like being able to shed a layer of your skin, right? It's that guarding, that post-traumatic response that I think first initially happens when you hear the diagnosis or you hear that you have to have these treatments or make these decisions, right? On some level, no matter how much we trust our doctors and caregivers, we protect ourselves from it. And so we tend to keep living our life in that sort of guarded protection mode sense. And so this helps them realize, hey, guess what? You can live again without having that guard up. It's okay to let it down. And so this is just one avenue to do that, right? And there's layers of it. So to be able to help even shed one layer of that is just so rewarding for me. And so then when I think back to where all this started for me, what is my why? Why do I do this? Why do I do these surgeries? Why does it mean so much? Because I think of my mom who went through it and didn't have anything like this. And I remember at that time thinking, how, how is it that with all the advances in healthcare and medicine that we've come so far, yet we've so lost that touch with that humanness and that beauty and that femininity and community that we kind of miss sometimes. And so this is a way to get that back or tap into that and help it wake up.
I literally have goosebumps right now because here's what I'm thinking. You mentioned the aloneness. So, as a two-time survivor, I felt that, and I had the most incredible support at home. And allergy season,
Yes.
get my throat coat going here. You feel that aloneness even when doesn't matter where your support system is and who's surrounding you, because it's a singular disease that you're dealing with.
Mhm.
Here's what I'm wondering, or here's what I was thinking when you were talking about that, Dr. Kurtovic. You know, after surgery, there are women, and I don't know if you experienced this at your retreat, but I feel like there are women who are very reticent to even touch or look at their bodies.
100%. Absolutely.
And
What you
so what's a story that maybe you can share with us from the retreat without naming any names that you saw? Because I'm thinking the togetherness of the community that has that same focus.
Mhm.
Um, your photographer there, and we need to get her name, we'll put it in the show notes. The photographer there who opened that beauty up. Do you have a story, one story you could share?
I mean, I do. I have one of the participants, um, she was the most guarded, definitely coming
Yeah.
into it, but and almost backed out and even admitted to me that first night. She said, you know what, I almost said that I was sick and I wasn't going to come. And I said, I'm not surprised. I said, that's how you know you need to be here. And so her and I talked about it that night before, and um, she was more reluctant to, the way that we sort of designed it, we're not asking everybody to completely go in the nude right away. Everyone has different comfort levels and there's no pressure and
Yeah.
we don't pressure anybody. So, that's one thing that makes it helpful. But so she was one of them who, one of the participants who kind of, oh, I'm going to go last. I'm going to go last. I'm, just kind of nervous and
Sure.
a bit more reluctant to, I don't think she thought she would have felt safe to disrobe any of her garments, and so what we do is part of the way that we again set it up for them to feel safe is we also worked with Lola Torch, who owns a company called High Tiger Lingerie, and so she creates
Ah,
custom lingerie for women of all body sizes, and in particular, once you've had breast reconstruction, you don't necessarily fit regular bras or what, you've had surgery scars and things like that. So we found that it was really tremendous to have the women be able to wear these garments for the photo shoot, right? They're going to be wearing that lingerie, and then they have some degree of cover up to start with.
Mhm.
Uh, so I really think it comes down to, I was blown away because I did not expect this participant to be so comfortable just taking it off. And she was. And I think it was because she was with a group of other women who were cheering her on. And she just that's what I can't even I can't describe it. It's sort of, it's like when you're watching a beautiful sunset and you try to capture it and you don't get all the colors. Like when you're there in person, there's just this magical resonance that's happening, and that really helped her feel like it was okay to do that. And I think that's really what it is. And I think, for me, when I pick people to participate, you have to be sort of at a certain place of trust. There's women at different levels of that. And I mean trust, meaning that they trust themselves, right? Because not everyone is has the same relationship with their body through all of their surgical and treatment experiences, but they have to be at a place where they're wanting to let go, or like you can tell that they're ready to let go of something, but they need some help still. But they're so, kind of one of the things that you describe, I see oftentimes, I'll see that with patients in clinic and after, they don't always want to touch the breast or the reconstructed breast. They're afraid, it feels strange. And so I try to work with women like that before someone who's not really ready to even touch themselves in their surgical area probably isn't ready for something like this. It would probably be a little overwhelming and then a little bit too much. But this particular participant was kind of like half half, and she just flew off, and I just couldn't believe it. Um,
You empowered her and allowed her to gain that trust in herself. You
yeah,
gave her that tool and that avenue through all the things you provided at this retreat and the community that was with
yeah.
her.
I'm going to share something because this was so powerful, and I feel like a lot of women would relate to this because she admitted well after a few months later, she said, or I can't remember if it was at the end of it, but after the fact, she said, I always felt like I was a bit of a prude and I just didn't want to share, and she was kind of proud of that, which is all fine. But then after this retreat, after the weekend, she says, you know what? I'm not a prude. That's my dad. That was my dad's voice. That's not me. And so I think a lot of us can relate to some level of that, right? Where it's somebody else who maybe, you know, kind of said something that stuck with us, and then
Yeah.
we repeat that, and then we live by that. And it's just, we don't
I
have to. You get
I
to decide
feel
what feels safe and what's good, not someone else.
it feels like the cocoon coming out of the butterfly. She got
Exactly.
she got
Her wings.
yes, she got
Her-
permission.
Yes.
And yeah, well, I think what I want listeners to hear this morning, I mean, I wish everybody could come to your retreat. We know
I
that's not possible, but the message this,
it's not possible yet. You never know. There could be, you never know. Let's just, for
I
now, it's
mean,
local.
there's a direct flight from Seattle to Tucson. I'm just thinking things here now, Dr. Kurtovic. But here's the message that I'd like to send to listeners. Um, if there's a program out there that you think, no, I don't need to go to that. It doesn't matter what it is. If it's some kind of retreat that's a renewal for patients who have been through breast cancer, breast surgery, breast reconstruction, I encourage you to dip your toes in the water, at least ask about it, get some guidance on it. Certainly, for those that are in your area or those that fly in and travel to your center, they can ask you about it, Dr. Kurtovic, because I think it's a beautiful way of, number one, reconnecting self, but gathering community, because I think that's so important after a diagnosis, after surgery, and it's part of recovery.
Yes, certainly. And
Yeah.
I would encourage people all over, more and more there are things like this, or it might not be necessarily this type of retreat, but like you said, any kind of program. I really believe that we are having more and more of programs and resources available for connecting people who've had medical treatments like this and different types of surgeries and things with breast cancer. I mean, I bet there's, we just have to ask and we have to look for it.
Yeah.
And oftentimes I really think, when you feel, if it makes them feel uncomfortable, that's how they know they should really explore it, because things that push us outside of our comfort zone are things that we need to be doing more and more of, all of us, because that's really how we evolve and grow and really heal. You don't want to be in a stagnant, unproductive, unhelpful pattern. I mean, or maybe you do, but I'm encouraging people to explore beyond those boundaries and to push their own limits, because that's where
I,
magic happens. When
I
you're the most terrified of something, that is when healing happens and magic happens.
honestly, I can't think of a better way to end this interview. Those are perfect words. Step outside your comfort zone, give it a try, and ask. Thank you
Yeah.
so much for this wonderful time to spend with you. I feel like I've been to a mini retreat today. I
Stay tuned.
really,
Might take it national. You never know.
you never
I have
know.
big dreams. So you know what? This is just the beginning. I think that this is one of those things that has potential in it, and it grows every year, and it's only the beginning. So
I love hearing that. Well,
yeah.
for those who are listening, again, I'm talking to Dr. Silvia Kurtovic, who is part of the team of surgeons at Tucson Plastic Surgery in Tucson, Arizona. And your team member, Dr. Raman Mahabir, we've interviewed before. So thank you for spending time with me today. Step
Thank you.
outside your comfort zone. Thank you, Dr. Kurtovic.
Thank you, Terry.
Absolutely.